So my school gave us access to a review course, and I feel like I wasn't learning as much. I feel like it was very dry. But here with Dr. Morante, he was very engaging. I learned so much in just this one day. Then I could learn from the review course that my school provided. He really focused on the topics that were high yield on the exam. And he was very funny, which made learning the material a lot more interesting, and I feel like it would stick. Yes, absolutely. I would recommend it to anyone studying for their board reviews. Yes, I am.
Hello everyone, my name is Pedro Morante. I'm a psychiatric mental health nurse practitioner, board certified, the founder and CEO of Pass Review. I would like to invite you for a one-day event called PMHNP Level Up Final Coaching Last Minute Preparation, happening in Los Angeles, California on September 6, 2025, Saturday. Please check out www.passnp.com for further details. See you there.
The content of this podcast is for informational and entertainment purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the guidance of your healthcare provider with any questions you may have regarding your mental or physical health. The views expressed are those of the host and guests and do not replace personalized care from a licensed professional.
Welcome to Mindful Moments with Pedro Morante, a space where a nurse practitioner and educator shares real talk on mental wellness, mindfulness, and navigating life in and out of healthcare. Let's take a moment to breathe, reflect, and grow together.
We, need as many nurses as we can. Nursing is a very beautiful profession. Showing up as yourself could really empower patients that have a hard time showing up for themselves. There have been many times in my life where I have been someone's nurse at their bedside, being my authentic self, speaking, carrying myself in the way that I always have. And I've seen other individuals get very inspired by that. I've seen other individuals say, I'm happy that you're in a position in which you can help. This really inspires me to help out, say, my son that's having a hard time. What advice do you have for my daughter that's going through a transition right now? Maybe just showing up and being truly accepting of who you are will have that ripple effect for other people to then be accepting of who they are.
Hello everyone, and thank you for joining us today. My name is Pedro Morante, and I'm board certified psychiatric mental health nurse practitioner. Today, I want to speak from both a clinical and human perspective on an important and often underrepresented topic, mental health within the LGBTQ+ community. The truth is clear. LGBTQ plus individuals are disproportionately affected by mental health challenges. And not because of who they are, but because of how the world often treats them. Whether it's rejection by family, bullying in school, discrimination in the workplace, or healthcare stigma, these chronic stressors take a deep toll on one's mental health. Studies consistently show higher rates of depression, anxiety, substance abuse, and suicidal ideation, especially among LGBTQ youth and transgender individuals. And I'm joined by a very highly esteemed PMHNP himself, Travis Brown. Dr. Travis Brown, welcome in the house. Thank you for your generous time and effort for coming into this podcast today.
Of course, thanks for having me.
Can you tell us about your PMHNP journey and your nursing journey and how you can connect with our topic for today?
Sure. Growing up as, a gay individual, always having that leadership component of being part of different organizations, some of them being in collegiate, being the president of the LGBT organization and undergrad, but also trying to incorporate that transparency into practice to really just show, just my patients that they can come to me for anything, and it's going to be non-judgmental. It's going to be open dialogue, but most importantly, that they're pretty safe with me.
Right. And you just recently passed your PMHNP board certification. Congratulations for that one. Woohoo!
Yeah, thank you.
How
I
you
did.
ready? So how will you use your platform or advocacy in terms of caring for this specific population?
Mhm. With this platform, it does give you that position of leadership, like I mentioned before. What you can do with that is be the front runner of upping your knowledge on not only this community, but the mental health that they face, that I currently face, and trying to incorporate that transparency of empathy, something that I have gone through to transpire into my practice, helping inspiring other people that you don't have to be a psych NP to be an advocate or a leader. Everyone in their everyday life can be a leader. You can find somebody, a friend, a family member that is within this community that might just need an extra phone call a week. It could be as simple as that, sending a text message of, I love you. I hope you're doing okay. Is there anything I can do for you? I'm here if you want to talk. I think those are different ways that you can advocate for me and like my practice, gearing more towards the avenues of LGBT centers. Maybe even practices that have the forefront of being in the community and being for the community. That would be the best way that I could do it as a psych NP. That way I'm working directly within my population of choice.
Great. That's very important to know what you're good at and also making sure what you can bring into the table as a provider. And that's very impactful in terms of how you can apply it with your current practice. So, what unique mental health challenges do LGBTQ individuals commonly face in comparison to the general population?
I alluded to this earlier. Higher rates of depression, anxiety, um, suicide, unfortunately, is a lot more prevalent. Sometimes it could be maybe even misdiagnosed with the anxiety and depression portion. A lot of it has to deal with acceptance. That's the overall theme is, are they one accepting of who they are?
Mhm.
And if they are excellent, there's more layers to it. What about the people around them, their loved ones? Are they accepting of who they are? Um, their coworkers. So those aspects that say the normal straight counterpart may never need to really ask themselves or go through, am I being accepted here? Will people like me for who I am? Will they hate me for who I am? And unfortunately, if it is the latter, say coming from home, that's the foundation of your life, your home life. Um, And if you can accept yourself for who you are and come to terms with who you are today, who you are tomorrow, who you were, it can predispose you to so much more thoughts of hopelessness, thoughts of what's the purpose of living a life if you can't be who you are. So I think going as a provider aspect, and knowing that a lot of patients are already predisposed to that, you can even gear some of your questions and even some of the treatment plans, that way it's a little bit more tailored to these individuals.
Okay, and that's important. And thank you for answering those. I'm hearing depression, anxiety, suicidal thoughts, and also the acceptance part is very important. And one thing what we're looking for is diversity, inclusion, and also making sure that everybody is accepted and like a gender affirmation. It's very important.
Mm.
So, how does minority stress theory explain the mental health disparities observed in LGBTQ communities?
The minority stress theory, it's the way that I could speak on it, in my opinion, would be it's like running a race, and everyone is running this race called life. When you are of a minority or even multiple minorities, it's like running the same race, but with more hurdles that you have to go through in life. Not everyone is going to be extremely um, fortunate to have less hurdles, but the more hurdles you have, such as being of uh, a person of color, being within the LGBT Q, having a disability, any of that, you're going to have a lot more hurdles and or baggage to run this race. And so when it comes to having other counterparts where you see that they don't have those same hurdles as you, it can be a lot harder to continue to want to run this race, let alone have the aspect of winning, whatever that may be. So I think with a lot of these individuals, it's really reminding them a lot of these hurdles can make you a lot stronger. It can make things a lot harder, though. Um, Having that understanding that a particular individual, a particular patient that I or you may be treating, knowing that the race that they are currently running, they may be really behind, and a lot of times it's not necessarily their fault, given the extra baggage that they have. Some individuals, unfortunately, if they are running the same race, and they see that others are several laps ahead of them, it can be really hard for them to continue to want to run at all. And having that understanding can really help us guide and be more gentle with certain individuals, um, to really give the aspect of not giving up.
Thank you, and those are great insights. Remember, minority stress could be caused by stigma, this prejudice, discrimination, and this could actually influence our mental health care outcomes for our patients. Okay, and my follow-up question to you, Dr. Travis, is that in what ways can healthcare providers create an inclusive and affirming environment for LGBTQ patients?
It could be in a multitude of ways. It could be very simple in the aspect of when you have, say, like your name on like, a little Zoom call or even on your badge, you could have your preferred pronouns on that. That little signal will tell a lot of individuals, you're safe with me and I will acknowledge you for who you are. Um, a little bit more than that, I know that there have been other individuals, say in person in clinic where they'll have their badge and at the bottom of the badge maybe it'll have like a little icon, maybe a little saying, sometimes a little strip that's like a rainbow. Again, those minute changes within the clinical environment can really set the tone of you're safe here, I see you, and that's not going to be an issue for me as your provider. Other things, you can even put on like say like the background of say like your office where it says safe place, you are safe here. It reminds me of There's this program, I believe it's one where I believe it's called Safe Place. I'm having trouble kind of remembering what it looks like, but it's I think it's of a child and it's yellow, and they were put on businesses to basically tell, say if a child wanted to run away from home, unfortunately, that they could run away there and that they are safe there. So having that little cues could say not necessarily run away to the provider, but you are safe here and that they're going to take care of you.
Right. And I think if they have a feeling of like universality, the feeling that they are heard, seen, and we're able to cater to their needs, make them feel safe, those are highly essential, especially when we're seeing our patients. Very important. And how do you approach assessing for depression, anxiety, and suicidality in LGBTQ youth and also the adults population?
I think going back to that foundation, really focusing as a provider on the social aspect of, say, like, their H&P. Where are they when it comes to who their family is? Most importantly, who they say that their family is. They may not say that their biological parents are within their family. It could be a multitude of people in their life, or maybe a lack of. That could be a really good foundation of knowing, are they more predisposed to anxiety and depression, even suicide, if, say, they don't come from a very accepting family, if they've been exiled from their family, even as well. Um, Coping mechanisms. If they have poor coping mechanisms, it would predispose them to even more health disparities, unfortunately. Even say if there's a history of drug and alcohol abuse, all of these are going to be compounded, and that understanding and even the treatment plan for that individual. Are they in therapy? Are they wanting to seek a therapist? That's also a really big thing as well. Not every therapist, unfortunately, is a good fit for every individual. Gearing the treatment plan towards finding the appropriate therapist, one that is very versed in this community, one that is their specialty as well. So really focusing on that foundation could be number one. Number two, understanding their process is going to be a little different. Maybe pharmacotherapy may not be for them. Maybe it is for them. Maybe therapy may not be for them. Understanding that their rates are higher amongst these individuals, not over diagnosing, but also not under treating as well.
Right. And then also, what role does family acceptance or rejection play in mental health outcomes of LGBTQ patients?
There have been several individuals that I've known, whether they are patients or not, and it is fairly clear difference between those that come from an accepting background, where, say, their parents are still in their life, um, versus the ones that aren't, and they don't have that foundation, that don't have, say, family in their life, unfortunately. There can be, not all the time, but there has sometimes been evidence of more hopelessness, sometimes as if the world may be out to get them, as if they can't trust anybody, if they are unfortunately off the ladder, if they don't have somebody in their life, such as their family member. Others say if they've had a picture perfect upbringing and then their family was very accepting, they never, you know, batted an eye or anything of that sort. They have more an aspect of, maybe there is a life to live. There is love out there for me. I do have that foundation of love as well. I don't have to overcompensate to try to find love and acceptance in this world. it's not always like that. There are certain individuals that had a very poor upbringing and
Mhm.
are doing excellent in this life. And there also are in the opposite spectrum that have had a loving family, and that have been very accepting of their identity, but maybe are having some challenges as well. It is a spectrum, like everything, but it does seem that the common pattern is having that foundation of the loving family, regardless of what the patient or the person defines as their family, truly would be that foundational aspect of love, longevity, and living a pretty healthy life.
Great, and protective factors matter. According to a lot of research, having a supportive family, schools, and communities has drastically reduced the risk of mental health issues and suicide. So that's very important piece that we need to solve for. And thank you so much for the wonderful insights. My next question to you is that what are best practices for addressing substance abuse and co-occurring disorders in the LGBTQ populations?
A lot of the research behind it, knowing that a lot of substance abuse can be a lot higher
Mm.
um, within this community. If there is that aspect of running this race with more weight, with more hurdles, the tendency to seek other, say, substances or things in this life that could make you feel better about maybe not running as fast as you would like to or as fast as other people in this life, it could be a lot higher. Assessing this, um, knowing the prevalence, but also in a non-judgmental, open communication dialogue about it. Continuously assessing how's everything going at home, how's your family, do you participate in any recreational drugs, any alcohol? Assessing that and then also continuously assessing depending on where they are. And if they are, um, using at the moment, if they are drinking as well, having them in a therapeutic relationship with, say, a therapist of some sort could really help with those negative beliefs about themselves that maybe they need to go down this avenue to use it to cope. Being able to switch out those coping mechanisms appropriately could lower, of course, the prevalence of it. But really, the research shows it is a lot higher. But with therapy, with the right help, with the right mental health provider, it can be drastically reduced or even eliminated. But a lot of the studies do show any group that is facing severe stress, facing um, disparities, any prejudices, are more likely to use any substance, more likely to use more alcohol as well. Um, so just knowing that it is harder for this individual and they may be more likely to use, but it doesn't necessarily mean that they would be using if they're not.
That's right. And then basically we want to look at like epigenetics or any underlying substance used before because there could be a imbalance for your dopamine and your GABA, which could be explained by predisposition of addiction. And then basically early screening. So we can do your cage questionnaire and also a lot of screening tools that we can incorporate in our practice. Great job. Okay. And then the next one is how do social determinants of health impact the mental wellness of LGBTQ persons, and how can clinicians address these issues?
I think it really has to do with knowing more about what's happening socially. What is well, where is the patient? What state are they currently living in? What are the laws within that state? What is, say, the political climate? as well what's going on. This individual might be at at risk for some of maybe like their rights being taken away, and that could be a really big aspect on how they present themselves in this world. If they again are in a environment in which they can flourish and they can be themselves, they're going to do a lot better at again running this race called life. However, if there is a poor climate that they're living in and the environment is not conducive to their overall growth, say, coming from a poor family, upbringing that doesn't accept them, having a political climate that is relinquishing their rights as well, it can predispose you to having a lot harder time. This could be increased um, again, depression, anxiety, other psychiatric challenges that they may have. Um, Increase in suicide is a lot higher in certain states in which their rights are not equal to, say, here, like in California. It can be a lot of work in the background for the provider to know where is this patient? Where are they living? What's the political climate? And that will at least give you the understanding of the hurdles in which they have to kind of go through to get the care that they need.
Thank you for highlighting those social determinants. And it's very important also to talk about health literacy too. And at the same time, making sure that everybody is informed about it and everybody is able to had like a proper education in terms of how when to seek help and that they can do like preventive measures, not only like early screening and also making sure that there's also tertiary prevention that we can do like a rehab treatment programs for them. Okay, very good. And as a provider, how do you stay updated on current research and guidelines related to LGBTQ mental health care?
A lot of that can be with collaboration, say with these communications that we're having right now. Diversity discussions are amazing. Attending seminars are also an amazing resource that is underutilized, especially during Pride Month right now. There are a lot of different things going on, say like in the Bay Area here in like San Francisco and Los Angeles, different speakers disseminating their research, being able to provide what are the new terms, what are the new scales for this individual that is more specialized and it's even more accurate in diagnosing this individual as well. Talking to your patients is also a big thing. I think a lot of times we can just go through the day to day and treat every patient the same, but knowing that this individual is going to be a little different, as every patient is very unique and very different, but being able to take what we've learned, say like online, the podcast that we're having right now, collaborating with other, say, allies or LGBT providers could be really impactful on just the everyday individual.
Great. And then I definitely agree with you, like keeping up with research, conference, seminars, and there's also like a organization called Fenway Institute, wherein we can go to their conference in Boston, wherein you attend seminars and conference which relates to gender affirmation, wherein they do this gender affirming care that improves the mental health care outcomes for our patients. Great job. And then, can you describe strategies to reduce stigma and discrimination experienced by LGBTQ patients within the mental health care?
Back in my doctoral program, I had to do a thesis, and it was assessing the stigmatizing attitudes that mental health providers have on not only their patients, but just the everyday individual. And within the scale that I used, it was a moderate amount of stigma that even mental health providers even have. The scale is I even took the scale myself, and it's very interesting to know that no one is virtually eliminated from stigma from anyone else and vice versa onto them. Knowing yourself that you may have biases, we all may have biases, and being able to challenge those biases on an everyday basis. Um, Really questioning, am I providing the best care? Am I appropriately addressing this person? Is this scale that has been around for X amount of years appropriate for this individual? Is this treatment plan appropriate? How can I better myself? How can I get new terminology for this individual as well? I think at first it really does come from the provider side that yes, we have had all this schooling. Yes, we have had, all the years of practice with the individuals, but showing up every single day knowing that we don't know it all, and that is a continuous spectrum of being better every single day. Every patient is going to be completely different. The other step with that, it would be knowing that these individuals are going to be more stigmatized. Exuberating maybe that initial thought that could be a potential bias could be something that this individual has already faced before. And if that's sensed even a little bit with this certain individual, it can really turn them off of mental health care forever. It could take a lot for a lot of these patients, a lot of these people to really open up and find a trusting environment to seek the care. But if there is stigma and amongst us providers, even if we feel that we don't, the tiniest bit of stigma can really wipe out any hope that patient may have. Thinking if they're stigma or if they're stigmatized outside, why would they go to see a provider, a nurse practitioner, a psychiatrist if they're also going to do it for them as well? So acknowledging all of us still have our biases. We can all get better about lowering those biases, questioning, have a questioning behavior of how can I better myself and how I can lower that implicit bias. Um, Talking to individuals is also a really big step. Knowing that your patient is unique and tailoring the care for them and the most less stigmatizing way would be the most impactful for them, and they will definitely come back.
Right. What I'm hearing from you is like having a patient-centric care and also making sure that we identify their needs and also being able to make sure that they are safe at all times with you as a provider. And that's very important. Welcoming, non-judgmental, all those words that I'm hearing from you are excellent. So, what changes would you like to see in healthcare policies or organizational culture to create a safer spaces for our LGBTQ plus staff and patients alike?
There have been certain changes that I've seen working in acute care as well, which has been really impactful. Little signs helps. Different bigger organizations will have, say, their patient on a billboard and say it's a same-sex couple or it's a transgender individual as well. Someone that is gender fluid within the company's logo at the bottom, and that statement alone says, "I see you. You are accepted here." And those are the changes I think that would be really impactful on websites as well, having again like a little like blurb, if you will. It could have, say, the rainbow flag says, just something of that sort, like, you are accepted here is also a really big one. Within certain EHRs, I've noticed that when you populate the patient's chart, it'll give their preferred pronouns. That's an excellent one, even their preferred name. That way, if their legal name or what is on their document is different by who they are and who they want to be addressed today, and if there is a transition happening, then we can address it appropriately. If there is that legal name, but we see the preferred name, in my mind, that's who they are. That's who I'm going to address them as. And until said otherwise, those type of steps can really show the patient you're safe here. I see you. How can I help you today?
Great job. And what advice would you give the LGBTQ plus individuals entering the nursing or healthcare profession who may be unsure of how to fully show up as themselves?
We one need as many nurses as we can. Nursing is a very beautiful profession. It has been around forever, more than it's been documented for us to help others. Showing up as yourself could really empower patients that have a hard time showing up for themselves. There have been many times in my life where I have been someone's nurse at their bedside, being my authentic self, speaking, carrying myself in the way that I always have. And I've seen other individuals get very inspired by that. I've seen other individuals say, I'm happy that you're in a position in which you can help. This really inspires me to help out, say, my son that's having a hard time. What advice do you have for my daughter that's going through a transition right now? And it can really create a ripple effect. You showing up authentically at work can really not show a huge impact at that very moment in time, but maybe just showing up and being truly accepting of who you are will have that ripple effect for other people to then be accepting of who they are. It doesn't necessarily have to be within the LGBT community, but when you can show up authentically and really try to be that leader, because nurses, we are leaders when it comes to healthcare, being at that bedside for the 12 hours for that patient, you are facilitating advocacy and leadership for that patient. And if you can show up authentically and who you are, it can be very transformative for a lot of patients.
Great. And I think the uniqueness and also the identification that you're sure about yourself and you're be able to bring that into the table and also caring for the patients beyond their needs and seeing them, hearing them, and also facilitating the involvement of their mental health is very important. Now, I would like to also get to know you as a person. Who is Travis beyond all what he's doing right now? How do you take care of your mental health?
Um, Really taking care of mental health is like taking care of physical health. I like to exercise almost every day when I can. Even the days I don't feel like exercising, I like to tell myself these endorphins afterward are going to make me feel great. Going outside, even some days when you're not really wanting to go outside, getting that vitamin D as well, can help out not only your physical health, but also can help with your sleep wake cycles, getting plenty of sleep, tons of water. I have also been uh, patient who has been in therapy for several years. I recently ended my relationship with my therapist because I think we got to a really good point. But there was that saying that every therapist needs a therapist. I think that every individual could benefit from therapy, especially those within the mental health spectrum, especially providers as well. Because we have to take care of ourselves. That's the very first thing that I like to do and I almost ask myself, not every day, but every day, how can I take care of myself? How can I feel better about this? Once you can kind of create these healthy habits, it doesn't feel like a healthy habit. It just feels like a normal day. I wake up every day. I have a 20-minute meditation that I like to do, preferably by the window. I typically chug water, and that's just something that I've been doing for years. That's something that I've known I need to do this for my foundation. Besides nursing, besides being a mental health provider, I'm an ordinary person. Yeah, I shop and at the grocery store. I go to parks, hikes. Yeah, I like hanging out with friends as well. recently moved. I'm still here in California, but now I'm out here in the Bay Area. Um, yeah, yeah, just an everyday person, I think, outside of nursing.
I love what I'm hearing. I think you've been practicing the 5 M's of mental health, and that's important too. Like meditation, mastery, movement, meaningful engagement, and meaningful connections, and also having like a community that supports you is also makes a difference, right? With one's mental health. And have you ever felt depressed, anxious, or at the lowest point in your life, Travis? And how did you keep up and hurdle those barriers that affect your mental health?
Of course, I think rarely has anyone really ever lived life and not had depressive moments, depressive weeks, anxiety that is just through the roof. During COVID, I think a lot of people, millions around the globe, if not billions, have experienced heightened anxiety, heightened depressive episodes where it could be a dark time for certain individuals. There have been several incidences in my life that have been considered dark moments. And those are the moments when I do reach the surface and I do overcome it. Those are the times that it makes me more inspired to help others to get out of their depressive episodes through their anxiety. The experiences that I have had within those episodes allowed my empathy to grow stronger and allowed me to become even a better provider. A saying that I like to, tell patients are, would you rather have an orthopedic surgeon that has never broken a bone or an orthopedic surgeon that has broken the bone and has gone through the therapy? Most patients are going to want the one that's had that experience because they know what it's like. And it's second nature for them just to know how it feels to be on the other side and to tailor that care appropriately.
Great. I think experience can bring so much into the table. So if we can relate well to our therapists, we can relate well to our providers, it makes an impact on how we can collaborate with them in terms of our care. Great job. And then also, if you can talk to your older self right now, what will you tell your older self?
Still here, still trying. I'm happy to live another day. Today has been eventful, but every day it's always a step towards where I want to be. And every time I am where I want to be, I always look back and think, I knew it. I told you so. Just keep on doing what I need to do, practicing my meditation, connecting with my friends and my family, my loved one, taking care of my body, taking care of my health. I would like to tell my older self right now with the practices, you're welcome.
Great. And 5 years from now, what are you doing 5 to 10 years from now? Where do you see your PMHNP career going into?
I would like to get different experience with different avenues, working within different patient populations. My community, the LGBT community, is a really big desire to facilitate one-on-one sessions with them, even being in a practice that is tailored towards this community. Eventually, opening up my own practice would be ideal within the next 5 years. To that way, I can have that safe place I talked about earlier, and it really being that transformative, transparent idea of you are safe here. This practice is tailored towards you. If there's any sort of hesitancy to other mental health practices in which you're w- wanting to seek, this is not going to be one of them. So within the next 5 years, getting all the experience that I can, whether it's acute care, whether it's emergency, telemedicine as well, which I'm currently working, but then gearing towards taking that experience within my own practice and it opening up the doors to my community.
Great job. Thank you so much for those wonderful insights. And you're going to be a great PMHNP. I'm so proud of you as your preceptor and also like your mentor. And Travis, for those who are experiencing test anxiety, I know you just conquered your tests and passed your PMHNP board examination. What piece of advice can you give them and those students that are experiencing test anxiety or have a lot of doubts in their mind right now?
Something that helped me was telling myself, you wouldn't have made it this far if you were to fail. You have the drive to already go through the schooling. You had the drive to pass school, to do what you need to do. The biggest breath of fresh air that I could tell myself before I passed the exam was, you're going to be a nurse practitioner. All you have to do is just take this test. This is inevitable. All you got to do is just go in there for a couple hours. That's it. And then you tell yourself every day, you will pass. Even within, the NCLEX, when before I became a nurse, a lot of the other students, I would always share that you will pass.
Mhm.
There's no doubt about it. If you put in your mind failure, there's a possibility of failure. But if you put in your mind, I'm going to study as much as I can, I'm going to incorporate this study material into my everyday life, I will pass. There is no other choice. And if you tell yourself, I will pass, there's no other choice, you'll pass. And it actually will help you. It feels slightly delusional when you first say it, but when you incorporate it and you really show yourself, I will pass, and I actually am studying a lot, that helped me. That really did help me.
Great. And a lot of positive mindset equals positive results. And I love what you're telling me that you will pass and you will absorb those energy, which is very important for you to achieve your board exam. And it's doable, guys. You can do it. I'm so proud of you, Dr. Travis Brown. Now you're a colleague, now you're a good friend of mine, and also I love your advocacy in your platform. I cannot wait how you evolve in this PMHNP journey of yours. And once again, let's give Travis a warm of applause. And I'm rooting for you, and I know you're gonna do great on this journey of yours. I'm so proud of you once again.
Yeah, thanks, Dr. Morante, for everything. I mean, the mentorship, when I was in school, the past course, I truly couldn't be here without you.
Yes, no, you did it also yourself, and you have a lot of ideas which you can bring into the table, which I'm so proud of you. Okay, all right. And any final words for those students or anybody who is tuning in right now with this podcast, who are struggling with their own mental health? What will be your one piece of advice for them?
It gets better. It gets better. Right now, putting in the work, doing things that you may not want to do, but knowing it will get you better, regardless of where you are on that journey, and just telling yourself every day, you are making yourself better. Every day, you have to get yourself out of bed. No one else can do that. Every day, you have to study. No one else can do that for you. So taking care of yourself, those little steps every day of what can I do to better me, it will get better. It always does.
Great. Mindfully healing one step at a time. You can do it. Right. Thank you so much, Travis, for your wonderful time.
Of course.
I'll be seeing you very soon. If you're here in LA, let me know. We can have dinner or something, okay? Hello everyone, my name is Pedro Morante. I'm a psychiatric mental health nurse practitioner, board certified, the founder and CEO of Pass Review. I would like to invite you for a one-day event called PMHNP Level Up Final Coaching Last Minute Preparation, happening in Los Angeles, California on September 6, 2025, Saturday. Please check out www.passnp.com for further details. See you there!
Thanks for listening to Mindful Moments with Pedro Morante. Be sure to follow the podcast so you'll never miss an episode. If you find value in our time together, leave a quick review. It helps more people discover the space we're creating. For updates and more reflections, follow us on social media. Until next time, take care.